Hi Berris, thanks very much for coming today. Berris, from my professional perspective, I see diabetes, type 2 diabetes specifically, purely as a set of symptoms. Can I ask your perspective on that and ask you how you see that diabetes is preventable?
I totally agree with you. Diabetes is a symptom. It's often a symptom of poor lifestyle choices, and that's not blaming anybody. People often don't know that they're doing the wrong thing. The simple fact of the matter is that if you're gaining weight, you're becoming overweight, or if you're becoming obese, you're at increased risk of developing type 2 diabetes. There is absolutely no doubt about that. And if you lose weight, particularly if you lose weight around the waist, then you significantly reduce the risk of developing type 2 diabetes. Now, that's not to say that only overweight people get type 2. Occasionally you can see slim people who will develop type 2 diabetes, but if you look, they will always be carrying a little bit of extra weight around the waist, and that's the real secret to this. You need to reduce your waist-hip ratio in order to help reduce the risk of type 2 diabetes. So it is preventable with the right diet, with weight loss, and with exercise that helps with that as well.
Okay, that makes a lot of sense. Now, a lot of my clients say to me that they've seen doctors and they've gained the impression that now that they've got diabetes, it can't be reversed. Would you agree with that?
Well, look, not entirely. I guess it depends what you mean by reversed. If you can get a person into a place, and I do this all the time in my clinic, where they don't have high blood sugar because we're looking after their diet and their lifestyle, then technically they don't have type 2 diabetes any longer. But that's not to say that if they go back to their old lifestyle, it's not going to return. It will return. So in a sense, we can say they're in remission, but really, they don't have the condition any longer.
Okay.
So, you know, in the treatment of type 2 diabetes, I talk to patients about diet, about lifestyle, about exercise in great depth, and that's very important. That's the starting point. I also sometimes prescribe herbs that help to reduce blood sugar, help to reduce the insulin resistance, and reduce sugar cravings. So that makes it much easier for them to comply with all the dietary advice that I'm giving them. There's also a number of nutrients that are extremely important, such as magnesium and chromium particularly, and B vitamins that are very important to make sure that sugar is metabolized well in the body. There's other nutrients as well, but they're the most common ones, and people are often deficient in those. So in the short term, they may have to supplement with those vitamins.
Okay, just on the lifestyle choices that you mentioned before, can you speak of some of the main lifestyle choices that make a big difference?
The main lifestyle things would be encouraging people to do some exercise, and if you have insulin resistance, then the best form of exercise is a combination of both cardiovascular and resistance. And that works very well and can work quite quickly at reducing the waist-hip ratio, therefore reducing the insulin resistance. We also have to look at diet. Now, rather than using and trying to get people to really stick to a very low carbohydrate diet, which usually doesn't work in the long term for people, I really concentrate more on encouraging people to eat foods that have a low glycemic index and have a low glycemic load at each meal. And I explain to people exactly what that means and exactly what sort of foods they should be eating in order to obtain that kind of diet.
There's another thought that actually occurs to me is some of my clients are actually to the point where they have the distal neuropathy that goes with diabetes, poor circulations. Like some of them have even had amputations. Like, can you, like, at that level of the ongoing developments in diabetes, do you still see it as reversible?
Look, the longer a person has any sort of condition, the harder it is to reverse. So, and you certainly, it's very difficult to reverse neuropathy and the microvascular damage that occurs, but there are herbs that can certainly help maximise the circulation that the person has. You may find that those people may not be able to come off their hypoglycemic medication necessarily, but they may be able to reduce it and be much, much better controlled when they're following the right diet and lifestyle and using the appropriate herbs and supplements to help with their sugar metabolism.
Oh, okay, thank you. And just bringing it to the end, is there anything that you think is important to say about diabetes that we haven't already covered?
I think that it is entirely preventable and it's entirely treatable in the majority of cases. It's as simple as that.